Yeah. So before we went on the lunch break, we were discussing about the personal lifestyle of the patient, the information that you have to gather. So in that, we were talking about the habits where we spoke about tea, coffee, alcohol, tobacco, etc., and you need to gather that information. Also, you need to gather if there is any high risk behavior like drug abuse or multiple sexual partners, etc. Those kind of um, high risk behaviors also, if you kind of feel that it's necessary to gather, that information is also important. Then you need to also gather information on the bowel movements. Now, when you are gathering the information on the bowel movements, you need to um, ask questions in terms of whether the bowels are regular or constipated, regular or irregular, first of all. So, regular or irregular. Now, what is regular bowel movements? What is regular bowel movements?
Yeah, I would say at least once a day.
At least once a day. Okay. Anybody else has a different viewpoint?
Someday,
Hello.
yes, someday no. Dr. Manish, can you hear me?
Yes, I can.
You.
I can hear you.
Okay, so go in different time of the day. Someday yes, someday no.
No. What I'm asking is, what is regular bowel movements according to you?
To me,
Yeah, I mean, asking questions. What do you think is regular? Okay, I think they're frozen again. Okay.
No, you're okay. I can hear you.
Yes, I think
Yes.
they're frozen. Gone back into the other room, is it?
Oh, yes, it may have frozen in there, but you're okay here.
Okay. So what's the whole challenge about sitting in that other room? I mean, I don't understand when there is such a bad network there, and it has to be interactive. I feel that they should be sitting in the classroom where there is interaction. Otherwise, I can record a video and send it across. No? That's the easiest way to do for me. I don't have to come here, sit here, and lecture. No? When we have had issues, we moved from that room, we spent 20 minutes on adjusting the whole thing. Now, again, if people are going and sitting in that room just because it's sunny, windy, whatever it is, but the important aspect here is to listen to what is happening here and have an interactive session. If that is not solving the purpose, then I can record a video next time onwards and send it across. That's the easiest thing to do for everyone, I think. If it has to be one way speaking. I'm sorry, but I have to say this. I may sound rude, but anyway, I'm
Yeah.
continuing.
Yes,
I am continuing because yeah,
I agree. I agree, Dr.
I
Manish.
don't kind of like this kind of thing where I keep on constantly. Anyway,
Yeah,
so
I agree. I agree. It would be better if we were all in the one room. So I think from next week, that's just the
no,
way.
this has to be the rule of the school that this is where you sit and do the lecture because
Yes.
it's not possible for constantly freezing, and if there's a network issue, then yes, obviously we have to sit in one room.
Yes,
Otherwise,
I agree.
yeah, okay.
I agree. Thanks, Dr. Manish, for letting us know. We shall implement that.
Okay, anyway. So when we talk about the bowel movements, so the regular bowel movements, like Nicole said, that once a day. Okay, and the reason I ask this question is because we have different ideas about what a regular bowel movement is. Okay, and I'll give you an example which will explain you what people think of regular is. When I used to do consultations in Japan, okay, and I was talking to people there, and I used to ask them this question that, do you have regular bowel movements? And they would say, yeah, we have regular bowel movements. And then when I said, okay, then when do you have the bowel movements? So for them, once in 2 days or once in 3 days was regular. So the concept of regular will vary from place to place depending on the kind of food they are consuming, etc. You know, in Japan, the food is a lot sticky. It's a lot, lighter, and their bowel movements are not every day. And I saw it across the population that the bowel movements were not regular. According to us, what is regular is once a day. Ayurveda also says once a day. But when I was speaking to them, I realized that they are having bowel movements maybe, once every second day, once or alternate day, and that was regular for them. But mind you, whilst I was doing the consultations with them, I also realized that these people had different health issues, and which were directly related to the bowel movements they were having. Most of these people, they had skin problems. Like if I was doing 10 consultations, I would say 6 to 7 people had skin problems. What kind of skin problems? There were eczemas, there was psoriasis. So all these kind of skin problems which primarily originate when the bowel movements are, when the body wastes are not being eliminated properly, and they tend to accumulate in the body for longer time, letting the body reabsorb the toxins back into the system. This is this is what I observed there. And in general, also I observed that when I was doing consultations in Tokyo and in Osaka, I found out that a lot of these people were, their main concerns faced were mainly skin problems, eczemas, various kinds of skin conditions. That was the most common thing that I experienced, which was again also because of couple of things. One is, the kind of lifestyle they had, also the amount of fermented and salty foods they have in their meals. So what does salty and fermented foods do? Salty and fermented foods basically aggravate the pitta and disturb the blood. And once the pitta is aggravated, rakta is disturbed, then the first thing or the most likely thing that is going to happen is basically skin conditions. So that is what I observed in a lot of people there. So when we are asking about bowel movements, we have to ask them whether the bowel movements are regular. We have to ask them about the consistency. What is the consistency? Whether they are well formed, whether they are loose, whether they are semi-solid. We have to ask them whether there is a tendency of shifting or variable stools also. Like we were discussing earlier about the variable stools, the stools moving from being loose to hard to loose, etc. So those variable consistencies is also something that has to be asked. Then the next question that needs to be asked is whether there is any bloating that is experienced. That also has to be asked in the related to bowels only. Whether there is tendency of gases, that also has to be asked. Whether there is any blood that is seen with the stool. So whether there is any bleeding tendency with the stools. So that also has to be asked. Now, what does bleeding indicate? What does blood with the stool indicate?
The hemorrhoids or piles?
So hemorrhoids or piles. So bleeding with stools happens because of two conditions. One is hemorrhoids and second is fissures. Okay, so hemorrhoids is basically a growth which is there, which is because of blood vessels, blood stagnation, the blood vessel, there is a growth there, which is basically accumulation of blood causing the blood vessel to enlarge there. And then as the bowels or the stools are passing, that causes friction on those on the skin, causing the skin to get damaged, resulting into bleeding. Without the bleeding, the growth can cause itching and pain and discomfort. That is hemorrhoids. And fissure is a condition which is directly arising from constipation or hard stools, which then, whilst passing, causes irritation of the soft mucosal lining of the digestive tract of the large intestine, resulting into cracking of that skin, resulting into an ulceration, which then bleeds. So when we ask for this condition, do you pass blood with the stools? If the person says yes, then the next question has to be, because now when the person says yes, that yes, I pass blood with the stools, then we have two conditions which are there, which are primarily, a fissure or a hemorrhoid. Now we need to distinguish between fissure and hemorrhoid. How do we distinguish that? We distinguish that by asking them a simple question, which is, do you bleed after passing the stools, or do the stools have, or are the stools smeared with blood? So the question that you ask is whether the stools are smeared with blood or whether you pass the blood after passing the stools. Now, what is that indication? What that indicates? When people have fissures, which is basically a skin ulceration, usually the stools will be smeared with blood, because as the stool is passing down, the fissure that is there, which will bleed, causing the stools to be smeared with blood. Whereas in case of hemorrhoids, it will be after the stools are passed, then the hemorrhoid will bleed, resulting into practically drops of blood falling into the pot. So this is how you differentiate between when the patient says, yes, I pass blood with the stools, or I have seen the blood passing with the stools, you ask them this question. Obviously, people will also tell you if they have hemorrhoids. Hemorrhoids are, are seen, can be felt, so the patient will also tell you that they have hemorrhoids, you know, or they don't have hemorrhoids. So that is also one. But if you want to do your own assessment, you can ask this question, and that will give you the answer as to whether the bleeding is through the hemorrhoids or it is through the fissures. Then asking questions about bloating, etc., that also gives you an idea as to whether the person digestive system is proper or not. Also ask a question whether you find any half digested food material in the stools. That is a very important thing. What does that indicate? If there is half digested food in the stools? Yes, but what will that indicate basically if there is half digested food?
That you're not absorbing properly the food?
Yeah, so one is you are not absorbing properly, but before the absorption, if there is half digested food, that will be
Weak
indicating,
acne?
yeah, a couple of things. One is the digestion is not yet complete. That is why you can see half digested food in the stools. So the first thing is the digestion is not getting completed. What does that mean? So the digestion can be incomplete because of two reasons. One is that the Agni is not strong enough. And second is the food is passing through the digestive system faster than it should pass. So the food is not staying in the digestive system long enough for the Agni to show its action and digest the food. So both these things can happen. So both these things need to be considered. If the person says that, you know, there is half digested food in my stools, then you have to look at whether the vayu that is functioning, the apana that is functioning, the samana that is functioning, is that functioning properly or not in the digestive system. And secondly, the apana and samana might be functioning properly, but if the agni itself is weak, then the chances of food not getting digested, being half digested, and and half digested food material being present in the stools will be seen. So when you ask about bowels, all these various things need to be questioned, asked, and clarified. Bowels will give you a lot of insights. One more or rather 2-3 more important questions that need to be asked about the bowels is, one is the smell. Are the bowels very foul smelling, very strong smelling? Okay, that is number one question that has to be asked. Smelly stools is also an indicator that the digestion is not happening properly. Second question is, are the stools sticky? So, you know, when the person evacuates the bowels, whether the stools, they stick to the pot. So if they are sticking, you need a lot of water to flush them out. You know, sometimes you might have to use the brush to clean it up. All that is an indicator that the stools are sticky. Stickiness in the stool is a direct indication of ama in the system. And the third question that has to be asked is, do your stools sink? Sinking stools is also, as you know, is an indicator of ama in the system. Now here, one thing which we have to understand is, sinking stools is not necessarily related to the consistency of the stools. I'll repeat again. Sinking stools or floating stools is not really related to consistency of the stools. Stools which are well formed, they can also sink and they can float. And in the same way, stools which are loose, liquidy, they will also sink and they will float. So it doesn't mean that just because a person has liquidy or semi-solid stools, they will always float. No. If there is ama, even the semi-solid stools will sink. So asking this question is important. Unfortunately, a lot of people don't look back after passing the bowels as to what they have passed out, what they have thrown out. They don't feel that is important. So maybe you may not get a lot of answers on this from a lot of people, but stickiness of the stools 100%, because even when they are cleaning themselves, they will require a lot more tissues than required by normally to clean themselves. The stickiness will still be there. So these questions will get answered properly. But as far as whether the stools sink or not, chances are that people may not understand. But you will have to ask them, or you'll have to tell them to keep a watch and tell you what is happening. But it will give you a basic idea as to whether there is ama or there is no presence of ama in the stools. Yes, Dori.
Sometimes they say it's sometimes it's sink and sometimes it's float.
Yeah, so basically the thing is that the the stool sinking or floating is an indicator of ama. Sometimes if there is no ama in the system, because the digestive system is also going to vary, right? One day, if it is not digesting the food properly, the stools may sink. Other days, when it is digesting the food properly, there is no ama in the system, the stools will float. So the variation will indicate whether there is ama in the system or no ama in the system. But as the armor gets chronic, long standing, then the stools will necessarily sink. Always sink.
So it means that if one day float and one day sink, there is this armor can get rid easily.
Yeah. So it's basically not very chronic, deep-seated armor, which is getting corrected based on your lifestyle, based on the food that you're consuming, based on how your Agni is functioning on that particular day. Because body is going to try and balance itself. That's the natural tendency of the body. So if there is armor formation, body knows that this is harmful for the body. So it is going to try and adjust itself. How will it adjust? It will give you indications that your appetite is less, you're feeling heavy, you don't feel like eating. Those kind of indications the body will give you, the signals. If we don't listen to those signals, then obviously we will eat, we'll create more problems. But even if we are a little bit aware of this and we know what that is indicating, and if we happen to fast, even though not completely, even if you fast partially, still that support that you have given to the body, that help that you have given to the Agni to digest the armor will be sufficient enough to digest the armor and the stools will float. Also, please understand that when there is less quantity of armor in the body, the stools may not necessarily always sink. Okay, so that also means that if there isn't a lot of armor in the body, the stools may be floating, but you may see coating on the tongue. You may see other signs of armor in the body. So whenever we are looking at it, when we are looking at signs and symptoms of armor, just because the stools are floating, but you see 4 other signs of armor, you don't say that, oh, because the stools were not floating, the person doesn't have armor. You will always go with what is the majority. If out of 10, you are seeing 4 signs of armor in the body, like there is lethargy, there is heaviness, the person is not getting up fresh in the morning, there is coating on the tongue, the Agni is not strong, but the stools are not sinking, you will still label or you will still understand that there is armor in the body. Yes.
And regarding to the coating on the tongue, is that correct? That from the tongue, you can tell which part of the digestive system is impacted? Like, if I remember, back of the tongue is probably the bowel, and I think in front it will be the stomach. I'm not sure.
So that, see, that is basically what I can say is there is a system of tongue diagnosis which exists, which has come from other modality. Okay, where just like we have reflexology on the feet and hand reflexology, where we divide or we kind of map your body on that region, in the same way, that system maps your digestive system on the tongue and does that. Okay. Is there a reference of this in Ayurveda, classical Ayurveda? No. Is that picking up some science and trying to apply it here? Yes. Whether it is correct, not correct, I am not sure personally. But I have seen people like Vasant Lad, etc., who have written Ayurvedic books in the initial times when Ayurveda was just becoming popular. They have used not just the tongue diagnosis from Chinese or Tibetan medicine, they have also used the urine testing method, or they have also given reference to the pulse diagnosis, which actually comes from Chinese medicine or the Tibetan medicine.
The eyes as well?
Eye as well. That is coming from iridology.
Isn't it Chinese medicine come from India? Like they not steal it, but they make their own thing from Ayurveda?
So culturally, traditionally, if we look at the Chinese and the Indians, okay, they are the oldest, one of the oldest cultures as such. So there was a lot of exchange that was happening. And when Buddhism came to India, it came basically from Southeast Asia into India, which brought in a lot of principles of, uh, you know, um, uh, these cultures also here. Simultaneously, when Buddhism became strong in India and they started moving around, they took a lot of concepts of yoga, Ayurveda, etc., to places like Thailand, Vietnam, and so on and so forth, where that became a part of the local culture and that developed further as the local medicine. So when we look at the Chinese medicine, I would not really say that Chinese medicine originates from Ayurveda. Okay, I would say that it existed simultaneously along with the Ayurvedic sciences. They had their way of diagnosis, they had their way of understanding the herbs, etc. They had their way of understanding the body physiologies, etc. Which is quite different than the Ayurvedic principle. But having said that, what I have observed is if one has to learn, say, pulse diagnosis, okay, one has to learn pulse diagnosis and use it in understanding of a patient in general without thinking whether it's an Ayurvedic concept or not. Chinese medicine has a good way of explaining pulse diagnosis. You know, they have a good way and a good method of explaining pulse diagnosis, which is easier to understand also, easier to learn also, whereas Ayurveda doesn't have much references of pulse diagnosis as such in the original text. So one can always use other sciences, take the best from those sciences and use them as long as those sciences are proven enough on the scale of experience and results for a long period of time. You know, so sciences like iridology, etc., which are recent ones, which are probably modified versions of this, or a concept like, say, tongue diagnosis in terms of the digestive system, etc. Those are modified concepts which do not really belong to these sciences as such. And that is something which remains questionable, debatable. But if we are looking at sciences, then yes, there are sciences that can be used, combined and applied together, as long as we are clear and we don't start saying that, you know, this is from Ayurveda, which may not be necessarily from Ayurveda. So yeah, so that's the thing. So as far as tongue is concerned, you can certainly understand the dosha imbalances based on the coating on the tongue. A whitish coating basically indicates kapha. A blackish coating or a dark coating indicates vata, whereas a reddish or yellowish coating indicates pitta. You know, the thickness of the coating will also indicate, you know, the more kapha, and so on and so forth. But apart from that, there is not much information apart from this in the Ayurvedic textbooks available in terms of tongue diagnosis or in terms of, you know, how to proceed with that. We also have to understand that a lot of textbooks, a lot of Ayurvedic books were destroyed in the various invasions that happened, you know, from the Mongols or from the Afghans on India, which also destroyed a lot of textbooks which were related to specific specialty topics or specialty subjects like pediatrics or diseases of the eyes, ophthalmology, etc. So maybe some books which were related to tongue diagnosis or which were related to pulse diagnosis, they might have also been destroyed, never seen. So that also is a possibility. But again, if we look at the basic textbook Charak Sushrut Vagbhat, you don't see references beyond what are there today, because those books have been intact, have not been damaged, nothing, no content has been lost from it, etc. So That's my take on this. So coming back to the bowels, we explained as to what all information you need to gather. The tongue also, we referred to that just now. Now we also talk about urine. You gather information about the urine in terms of, the consistency of the or frequency of the urine. Does a person need to wake up in the night to pass the urine, etc. All this information has to be gathered, which also gives you indicators in terms of what is the health situation. Then we already have asked these questions which are there in terms of nature of work, position during working, etc. So that we can always ask during the occupation related questions and get more information, which gives you more insights into what they are doing work-wise, how intense their work is, what kind of work it is, whether it is physical work, whether it is mental work, because physical work will involve a lot of muscle activity, which is going to be joint and muscle related, whereas a mental work will involve a lot of mind, majja dhatu, rasa dhatu, etc. So that will give you an idea that if there is any stress related to physical work, then that's going to cause damage to the joints and the muscles. Whereas if there is stress related to mental work, then that is going to cause damage to rasa dhatu and the majja dhatu. So that understanding you will get from the occupation or the type of work they do. So social and occupational history, you need to understand about the upbringing, home life, occupation, relationship and domestic circumstances, sexual activity and leisure activities. Now, why this is important is because in today's world, we see that people, the younger generation today is a lot more affected by these things than the previous generations were. What I mean by that is, today if you go and talk to the generation today, they will have a lot of issues rooting from their family life or the way, their relationship with the parents was, etc. So so this information is important for us, because if there is a health problem that is being shown by or exhibited by a patient, we need to know if the family background or the way the relationships were has some role to play in that. Because if that is the case, then you also may be required to involve some kind of counseling along with the medications that you're giving, some kind of Satvavajay Chikitsa, which is strengthening the mind kind of a treatment, which might be involved in these kind of situations. And that is the reason this information is important to relationships and domestic circumstances. Obviously, this is also important because a lot of times, like we have spoken about this earlier, different srotasas, they have different relationships with the emotional factors. Like Rasava srotas can get disturbed if there is disturbance in the relationships. Relationship maybe with your partner, with your husband, with your father, with your mother, maybe with your brother, sister, people who you love, who you care about. So if there is a disturbance, or if the relationship is disturbed, there is a problem in that relationship, that can cause disturbances with the rasa dhatu, that can cause disturbances with the rasava srotas, and that is a simple example of what can happen. Then similarly, if uh, emotional factors in relationship, like for example, anger, irritability is a dominant emotion in a relationship constantly, then basically that will also impact certain tissues, that will impact your liver, that will impact your rakta dhatu, that will impact your rasa dhatu. So that understanding is also important. If suppose in a relationship you are constantly being bullied by somebody, then there is fear aspect coming in, where you are scared to be in that relationship. That also will affect your liver and your blood, etc. So this information in terms of your relationships and domestic circumstances, how is the upbringing, how was the relationship with your parents, that plays an important role in certain diseases, certain health situations that may be faced by the patient in the later stages of life. Like we spoke about this, that disturbances with the Rasava Srotas can then result into breast cancers, cervical cancers, etc. If the relationship with the mother or father was not that great, bad breakups, bitter breakups with the husband or with the partners can result into direct problems in menstruations, etc., like premature menopause, early menopause, reduced menstruation. Um, all these kind of conditions can be seen where the cause or the causative factor will lie in one of these things, which might be your upbringing, which might be your relationship and domestic circumstances, etc. So that is why this information is important, may not be important in every single situation, but gathering this information certainly helps. Then we also ask about the treatment history, where we ask about the medical history, surgical history. So if we are, if a particular condition is explained or indicated by a person, then has he or she taken any treatment for that? Has there been any surgery done on that person for that particular condition? That also needs to be checked, because that also gives you insights into what level of problem it is, whether that can be completely corrected or not. Because a lot of times people do corrective surgeries. Okay, corrective surgeries are done, and then they expect that now you treat us with Ayurveda and correct the structural problem. So one thing which we have to understand is physiological problems can be corrected, structural problems cannot be corrected by medication or even Ayurveda. Structural problems can only be corrected by surgery. They cannot be corrected by taking medicines or doing panchakarma or doing massages, etc., etc. So that knowledge or that awareness has to be there, that structural problems cannot be corrected by medication. Then psychological history of the patient, mood of the patient, whether the patient has any of these conditions, anxiety, depression, irritability, obsession, neurosis, and other psychological issues, maybe schizophrenia, bipolar, etc. So we should be aware of it, because that may be one of the important reasons why the person is seeing you, or it can be a problem situation for you whilst treating the person. Because if the person is anxious, if the person is depressed, then whatever you suggest, the person is not going to do it at all. So there you will have to strongly look at mind strengthening treatment with help of herbs, treatments, etc., etc., before you start any other treatment. So I'll give you an example. So when we look at, we'll continue with the same example of irritable bowel that we spoke about earlier. Now, irritable bowel syndrome can also be caused by stress or emotional disturbance. Now, when irritable bowel syndrome is being caused because of stress or emotional disturbances, there, even if you are giving any kind of a medication that is helpful for irritable bowel, the results are going to be limited, because your positive factor, which is the emotional disturbance, needs to be corrected. If that is not corrected, your medication will only have a limited effect on the person, or a limited impact on the health of the person. So for example, if somebody is stressed, and that stress is causing the symptoms of irritable bowel to flare up, then obviously stress management will become the treatment, rather than focusing on irritable bowel and giving treatment for irritable bowel. There are herbs which are specifically used for irritable bowel. We will study one of those herbs, very soon. It is called as Kutaja. Okay, Kutaja, Kutaja, Kutaja. In Latin, it is called as Holerina antidecentrica. The name itself is Holerina antidecentrica. So it's a herb which is used for dysentery. Now, what is dysentery? Dysentery is infectious diarrhea. Diarrhea caused because of infection. So it is a herb advised for dysentery. But one of the important uses of that is it is used in irritable bowel syndrome also. Now, when you see a person like this who is having variable stools, bloating, passing mucus along with the stools, you are going to be thinking of using Kutaja as the first choice of herb for this person. But if the root cause of that or the trigger of that is stress, then even if you give Kutaja, the problem is not going to get resolved till you basically correct the stress. So there my primary herb of choice will be Brahmi. So that Brahmi will correct the stress, and along with that I will give Kutaja so that the symptoms will also reduce. But because the stress has reduced, the trigger is also taken care of and the flaring up situation will stop. Yes.
I had a recent client that I suggested Brahmi, and she got very, very heated action, which well, Brahmi is more like cooling, I guess. So, well, I know that she has a very high pitta condition thing, but the Brahmi was to pacify because that was the mental is it's huge. But she wanted to stop. So how can we explain that it has given such a heat? I know that with the detox, the pitta was it was just going out to it was very high. So how
No,
come
so basically, the thing is, what happens is a lot of times when people are using supplements, okay, we are not aware of how the supplements are being manufactured. Okay, so say for example, this was a Bacopa capsule. Was it a capsule?
Yeah, because I've been honest and told her that it's very bitter and hard to eat. So,
So basically what happens is a lot of times if it's a capsule and if it's an extract which is being used, okay, extraction is done by two methods. Okay, there is a CO2 extraction and there is an alcohol extraction. Now when you do CO2 extraction, which is a gas extraction method, the chances of Brahmi becoming heating in action are less. But when you're using alcohol as an extraction tool, then obviously you're fiddling with the characteristic of the herb, which can then cause flaring up of the heat, etc. So it is important to understand how what kind of extraction method is being used by the company to make those extracts, because one is understanding the potency of the extract, but it is also important to understand what method was used for extraction, which can be a reason for that. One of the reasons. Other reason can be that, is just the dose was heavier than what was supposed to be given. That can be another reason. But in this case, what you do is you counter it with something. You counter it with coconut water, you counter it with milk, etc. So that then, the problem is not that severe. Okay. But honestly, I personally feel that Brahmi is a fantastic herb. I mean, it's a fantastic herb, and particularly there is one product that is there in the center also, which is called as Prasham. And I would recommend that, even if you don't have any problem, psychological problem or mental health issue, you should, as an experience, and I'm talking positive experience. I'm not talking experience in terms of, the effect of drug as such. As an experience, when we say that uh, a, a substance has an effect, okay, there is a liquid wine preparation called as prasham, which is there in the center. And I would strongly recommend that everybody who is, studying Ayurveda should take that product 1 tablespoon just one day to see how they feel the next day. I'm not saying go on that medicine and take that. Okay. I am saying if you want to experience how one dose of a medicine can make a massive difference in the way you feel, just taking prasham 3 or 4 hours before the sleep, 1 tablespoon or 2 tablespoons with equal amount of water, and you yourself see how you feel the next day. You feel rested, you feel that your sleep was extremely sound, it was a deep sleep, you were not disturbed at all in the sleep. So all the positive things that we look at when we take a substance like Brahmi, you will experience basically when you take this medicated wine. And just for that experience, I will recommend that everybody who is studying Ayurveda should take that to experience how, when we are going to give it to the patient, unless we are confident what it does to as a product, it's difficult for us to be confident enough to administer it to someone. So there are products which are like this. There are, like Brahmi is one of the, Prasham is one of them. There is another product called Sanjeevani, which I spoke briefly about last time, as a product for infections and diarrhea, etc. So products like these are like one dose products. You give one dose and you see the results. You don't have to take 3-4 doses to see the results. Those are the kind of results you get, which then actually build a lot of confidence in you also, that yes, even if I give this in one dose, the patient is going to feel better. That is the level of confidence it develops. So anyway, so coming back to this, um, even in cases of psoriasis, for example, yeah, Doreen.
About Rasham, I'm just looking at it. It's on tablets, tabs. Is that fine?
So the liquid works better. Liquid works better than the tablets because the liquid is a wine, so it gets absorbed faster and gives a faster result, obviously.
Would you well, obviously I'm talking for myself, but would you recommend it for someone who has lot of that annoying?
Lot of vata what?
Annoying, if I can politely say.
Irritability. Irritability.
No, irritability is more pitta, like a lot of sadness, many thoughts that disturb the mind and it's annoying.
Right,
Okay.
right. Because Prasham basically has couple of ingredients. One of the ingredient of Prasham is Brahmi, which is directly like a rasayan for the Majja Dhatu and the mind, etc. But it also has something called as Jatamansi, which is called as Nardostachys jatamansi. Now, this herb is known as it eliminates what do you say, nightmares. Okay, so it eliminates nightmares. So somebody who complains about nightmares, this herb is known to do that. It gives you a feeling of euphoria in a good way. Okay, so basically it improves your mood, it elevates your mood also calms down the mind. So the anxiety is reduced. The mind is happier. You feel happier. At the same time, if you're having a problem sleeping and because you wake up because of nightmares, there are people who complain that every time they sleep, they get nightmares. So that's the herb which is specifically suggested for that. So we can use those kind of herbs which will, and Brahmi Prasham is a combination of that. Along with that, there is calamus in it, which is also known as a excellent nervine tonic. Then it has got Sarpagandha in it, which is known for reducing hypertension, blood pressure. So if you see, it will reduce your blood pressure, it will calm you down, it will calm the nerves, it will reduce the irritability of the nerves, it will make you happy. So overall result of a product like Prasham is not just improving your mental strength. It is going to be a more holistic, more profound effect because of all the other herbs which are also added in. So I was talking about a condition like psoriasis, for example. Okay, in a lot of patients, psoriasis also is related to psychological problems. A lot of people also get flare-ups of psoriasis when they are stressed. So in those people also, along with the herbs that you are giving for psoriasis, you need to use a product like Prasham or Brahmi, without which you will not get the results. But for that, you should know about their mental condition, about their psychological condition. You should know how the mind is working, etc. And then accordingly use the product. Then the next history is the gynecological history. This is obviously it's female specific, so you'll ask menstruation details. So what kind of menstruation details you'll ask? You'll ask about whether the periods are regular. You know, if the periods are regular, how many days, after how many days you have the period, for how many days you have the menstruation, 4 days, 6 days, etc. Is it strong, medium, or light? Ask about the quality of the menstruation. Quality of the menstruation meaning, is the blood very thick? Is the blood the menstrual fluid very strong smelling? Does it leave stains if on the fabric, etc.? Ask all these questions because those are indicators of the dosha imbalances in the system. So menstruation details. Then if the person has problems, the problems can be painful menstruation, problems can be pain during menstruation in the abdomen, pain during menstruation in the thighs. Some people, some women, if it's a pitta related problem with menstruation, they will exhibit signs and symptoms like headaches and nausea and diarrhea. If it's a vata related problem, they will exhibit signs like mood swings and depression and feeling sad before the menstruation. So menstrual history will be important because it will give you an idea of the imbalances of doshas related to the Artha Srotas. If it's menopause, then you need to ask about the menopause. When did the female have the menopause? Whether the menopause was normal? Did she have any problems related to menopause, etc.? During the menopause, obviously, you also get a lot of patients who come to you because of when they are in the menopausal state. In the menopausal state, there will be a lot of health issues women will have. Okay, and those health issues will impact the overall physiologies of the body also. So here you will have to understand that there are a lot of hormonal changes happening in the body, due to which there will be a lot of physiological changes that will happen in the body, which can then cause more, which will then present itself as a different picture than what you are seeing. So say for example, when menopause starts, women are likely to gain weight. The skin becomes dry, mood swings happen, irritability increases, appetite changes. So all these things will be seen. Energy levels are down, tiredness increases. So all these things will be seen, which you will have to ask whilst asking questions about menopause, and you will have to then note them down so that you clearly basically understand that these are menopause related issues and deal with them specifically according to that. There are herbs which have been explained in Ayurveda specifically for the menopausal problems also. We will be we'll be studying a couple of them. You have studied one herb already when you studied, which is called as Saraka indica Ashoka. So we have studied that herb Saraka indica Ashoka, which is related to, which had main effect was on the female reproductive system, which is correcting the menstruation, etc. That is also used as a tonic for correcting the menopausal problems. Okay, so taking the gynecological history is important. Then obstetrical history, which is history of pregnancies, how many children do you have, were there any abortions or miscarriages, how were the deliveries, whether they're normal or C-section. All this information also needs to be gathered. Abortions and miscarriages are important to understand because that gives you an indication that there is a likely possibility of disturbances with the apana. So asking the question about abortions and miscarriages is important. That can help you in understanding a couple of things in terms of whether apana is functioning correctly or not. Otherwise, you ask the questions about pregnancies, that will also tell you about how strong the Shukra Dhatu is. More pregnancies basically indicate a stronger Shukra Dhatu because that clearly indicates the state of fertility in that female. So that will indicate the strength of Shukra Dhatu to a certain extent. So that is the reason we ask these questions, to get a clarity on that aspect. Then the next one is now called as Ashtavidha Pariksha, which means 8 different examinations which are to be done. Couple of them we have already asked, so they can be included here or there earlier, wherever you want. So the first one is pulse. Okay, so pulse diagnosis, and as we have said that there is a limited information of pulse diagnosis in Ayurveda, so we will primarily be doing the pulse diagnosis to understand the dosha dominances, and pulse diagnosis has to be done early morning, empty stomach, to get a more clearer picture of the doshas in the body. Because otherwise, during other timings of the day, the food will have a major impact on the pulse reading. The stage of the digestion will have major impact on the pulse reading, and that is why pulse has to be taken empty stomach early morning, first thing, so that you get a better understanding of the pulse and the dosha situation in the body. Then the malas, when we are asking about malas, we have asked all of these questions. We explained this. Baddha means well-formed, Abadha means loose, Prakruta means normal, Vikruta means abnormal, Atisara means diarrhea, Pravahika means excessive straining is required for passing the stools, that is Pravahika, and Grahani is basically where there is mucus along with the stools, and the stools, they vary between hard and loose. Okay. Then in the mutra, that is urine, we ask questions about frequency, day and night, color, and other associated complaints like painful micturition, burning micturition, etc. Strong smell, sweet odor. A lot of times people who are diabetic, they have a very sweet odor to their urine, like a fruity odor. So that also we have to ask. Frequency, day and night, how many times in a day, whether the person has to get up at night. If the person has to get up at night, then we also need to keep in mind the possibility of diabetic condition, because diabetic patients have to get up at night to pass urine, which is a typical symptom of diabetes, which is nocturnal urination, which is urination during the night. So asking that questions gives you a little bit more insight into whether there is everything is normal, or we need to also look at other conditions like diabetes, etc. Then we have also talked about, yes, Doreen.
So regarding to the pulse, if we don't, there is no need to do it during any time of the day. Because I mean, we won't have a patient that before they eat and
Sorry,
during,
sorry.
during
Pulse.
you have the clients, right? So you don't take any pulse during the day then.
No, you take the pulse, but usually, like in India, what people do is, like what the Ayurvedic doctors do is that when they are doing the analysis for the first time of any patient, they call the patient at least for the case taking, early morning empty stomach.
Oh, okay.
Okay. So the case taking is done by the doctor or maybe their assistant. They will take the pulse, etc. If the doctor is there, they will take the pulse, or the assistant will take the pulse, note down the pulse, and then the patient can come in for a detailed consultation later on also. So that is what is practiced here. Having said that, is it possible in Australia? Probably not. But then we will have to find out a way where we at least, have a method of understanding pulse. Otherwise, we are not getting a reading of the accurate reading of the pulse, so to say. Okay. Just give me a second. I'm just getting a repeated call from my office. I'll just check if sorry guys. Okay. So regarding the tongue, we have spoken that we have to check the coating on the tongue, coloration on the discoloration on the tongue. We also have to check about cracking of the tongue. There will be sometimes there is cracking on the tongue. Sometimes you also have to observe the sides of the tongue. A lot of times people they have very sharp teeth. Okay, and those sharp teeth can cause ulcerations on the sides of the tongue, so that also we have to check. Now, what do sharp teeth indicate? Yes,
Sorry, Dawn.
Acidity, pitta.
yes, acidity, pitta. So when there is excess of pitta, then the teeth can become sharp after some time, so that's not the natural thing. So what is happening is, because of the acidic action, because of the chelating action of the acid, the teeth are becoming sharper, which then can cause ulcerations or lacerations on the tongue. So sharp teeth is an indicator. So if you see that, then obviously you will ask questions about what is the taste in your mouth, whether the mouth taste is sour or bitter or pungent. Why? Because if there is more acid, obviously, one of these tastes has to be there in the mouth. You will observe the coating, whether there is more yellowish coating on the tongue. You will ask the person whether the person has a tendency of mouth ulcers, because mouth ulcers will happen when excess pitta is present in the oral cavity. So one thing will give you information about a couple of other things which you need to confirm by asking questions. Then Shabda, which is the voice, which is normal or Vikrut. So whether there is hoarseness of voice, whether the person is speaking properly or not, whether it's a blurred speech, whether it is rapid speech, whether it is irrelevant speech, all that will be basically understood under Shabda, which is the speech. Then sparsha. Sparsha is touch. So whether the skin touch is hot, whether it is not hot, whether it is dry, whether it is soft, whether it is unctuous, whether it is cold, all that will be checked by touching the skin, by touching the patient's skin and noted down. Then we look at the Dashavidha examination, which is the 10-fold examination, where we understand the Prakriti. So now here, how will you do analysis of a constitution of a person quickly?
Can you repeat, please?
I said, if you have to do, like now you are dealing with a patient. Now, one of the things is understanding constitution. So how will you do an analysis of constitution quickly? Because we don't have much time to do that. So what will be the methodology you will use to understand the constitution quickly?
Physically, you can tell.
So physically you will tell, but so basically physically you will tell, physically you are already observing the client, patient all the time. So that will give you an idea of physical characteristics. You would have asked a lot of questions whilst coming to this stage, about the Agni, about the bowels, about the urine, etc., etc., which would also give you an indication to a certain degree of what the constitution is like. Correct? Whilst you are analyzing the Vikruti, you will also understand a little bit of Prakriti whilst doing that. So that has given you an indication. Now, what remains to be done here is primarily understanding certain psychological characters of the person that will lead to a finalization on the constitution aspect. Correct? So, say for example, by this time, you have come to a realization that this person is most likely a Pitta Vata type of a person. Then what will you ask now just to reconfirm that at the level of emotions or psychology? Which questions would you ask?
How they spend money, for example, if they are adventure, if they take risks, if they like calculated risk, 2 or 3 questions that you can like
So
define there.
what do you spend your money on? Correct? That would be one of the questions. Right? What else, Pedro? What did you say? Are you adventurous?
Yeah, if you take risks, adventurous type, and how you will react under pressure. I don't know, and you can put like any example. I don't know, if it's a robbery or something's happening next to you, you will, or your neighbor is being robbed. What you do? Something like that, no?
Okay, yeah. So couple of questions like this, like how will you spend the money on, or what are you adventurous, or what are your hobbies? What do you like to do? You like to paint, you like to do art, so you like to travel, what do you do? Are you adventurous? Do you like to take risks? So those kind of questions will bring you to a understanding or more concrete understanding at a psychological level in terms of what is the constitution of the person. Simply because these things, the primary emotion of a Vata person is fear and sorrow or grief. So fear is the primary emotion. What is the primary emotion of Pitta person? Irritability, anger is the primary emotion. What is the primary emotion of Kapha? Not getting perturbed, holding on to things. That is the primary emotion. We'll not say anything, but we'll hold on to things. So when you understand people differently, you'll understand that these are the primary things that you have to ask for. As far as the Vata person is concerned, what does the person spend money on? The person will spend money on unnecessary things. You know, impulsive buying. Doesn't think before buying. Whether, so a lot of things that this person buys will be just staying there in the house without being used. So just because somebody says I buy books doesn't mean that it's a kapha character. Buying books is not a kapha character. Reading books is a kapha character. Yeah. So impulsive buying is basically a vata character. So you will have to ask that type of question. Pitta people will basically, yeah, Rohit.
So how do we know it's not a Vikruti at that time?
So for that you will ask that, have you been always like this? Have you always been impulsive in terms of buying? If you
Okay.
buy things, do you use them? You already have things, still you buy the same things again. So those are the things which will tell you that, that's an impulsive buying unnecessary stuff. What do Ayurvedic books say? Ayurvedic books say Vata people are poor. Pitta people are rich. And Kapha people are rich. Now, what has that to do with constitution? So basically what they are saying is Vata people are poor because they spend money on useless things and lose money. Pitta people, they are rich. Are they really rich? Are they really having money? May not be, but you will feel that they are rich because of the way they dress up, the kind of clothes they wear, the kind of perfumes they wear, etc., etc. So the perception is of rich. And Kapha people are rich because they like to, keep the money aside, invest it. So that's the reason why they will be rich. So in the realistic sense, if you have to look at bank balances as a criteria, then the person who is likely to have a better bank balance because of proper utilization of money. I'm only talking of utilization of money, utilization of resources. I'm not talking of entrepreneurship, etc., etc. Okay, because then Pitta people or Vata people can also have a lot of money. But a kapha person will, if given 10 rupees to each of these, the kapha person will end up having 10 rupees for more longer duration of time than the other two. So coming back to what we are discussing is that the spending is different. Pitta people will end up spending money on luxury things, good things. They'll spend money on, like they have said that they like to wear colorful clothes. They like to wear colorful clothes because that's the pitta trait. They like to wear perfumes. Why? Because that's a pitta trait. They sweat a lot. They don't like sweating. They don't like their body to smell bad. That is why they use perfumes. So there is a reason for why all this is happening. There is a reason in terms of how their physiologies are functioning. There is a reason why they will do this. There was a very interesting question which Pedro had asked in the last retreat. What was the question, Pedro? Can you?
About what?
About the work, yeah. So he had said that he has seen a lot of people who are basically, we were talking about obese people, right? Fat people.
Yeah, we were talking like how can like a high pita be like super like concentrate in work and have like a lot of money and like being like not concentrate in like that energy in like his physical aspect and be like obese but be like super successful at work.
Yeah. So that was a very interesting question because what he said was, how can a pitta person who is so driven not be driven in personal life and become obese? Because if a Pitta person is organized, regimented, etc., then why does that person not be organized in his personal life, eat healthy food, go and exercise, have a regimented life, and be, healthy and in a good physical state? So the answer to that was basically that these people, end of the day, when we say Pitta is all about acquiring worldly things. Okay, so when you are in that stage of life where you want to achieve success, which is you achieve success, you need validation. That validation is coming from the world, validation is coming from the society. That is where these people are extremely organized in work. Why? Because they want to prove themselves, not only to themselves, but to the world that they are successful. They want to have the best car, the best house, everything, best clothes. So they want to earn money. So they are driven by that. But whilst doing this, they lose track at the personal life level and do not pay attention to that a lot of times and can become obese. But the same people, if they understand the value of being healthy and they decide to do it, they would be the first ones to just stick to a regime and follow it religiously and lose weight, become most healthy, most fit people in the world. So it is about the drive. It is about the drive where the focus is. And when the focus is on work, when the focus is on achieving things, these people will only be focusing on work, not paying attention to things in their personal life. You see so many people, so many Pitta people, they will tell you, I am extremely organized at work, but I am messy in my house. How is that possible? If it's a Pitta constitution and being organized is the basic attribute, how is it possible that the person is organized at work and messy in their house? Their rooms are not organized, but their offices are organized. That is only because Pitta is all about how do I look in front of the world. And it will take only one person coming in this house and saying, what are you living in this, shit place, this horrible place, this dirty place? That one statement will change everything for that person. So it's about the perceived value, validation from the world, which is what drives Pitta people a lot. And that is why you will find a lot of people who are Pitta constitution, extremely organized at work, but when I say work is in their careers, but not organized in their personal lives. And you will obviously see people who are obsessive also. I mean, I remember I was talking to the students last time and we were doing a constitutional analysis. And and when I say you observe things, is I was sitting across this person doing consultation and I was at the retreat, okay, and there was a wooden table and there was a tablecloth on top of it. And since the time I sat down for consultation, this patient of mine was constantly correcting the tablecloth so that it doesn't go here and there a little bit. Not a single crease. She was, straightening it up, correcting it whilst talking to me. So when we sit down and when we say that you observe, these are the things that you observe because that gives you a massive insight into the constitution of the person. The kind of, clothes they wear, it's an indicator, the person has come for a retreat and you have, the same color shoes going with the top or the bottom, you have the same type of earrings, the frame of your specs is matching to your clothes. That's a no-brainer. That's a Pitta. So, but it is important that you have to keep your eyes open and observe this. You don't have to go and tell anyone, but you have to observe this. And that is why I love airports for the same reason. You know, because you go there, you sit there and you just sit there having, you know, your tea or coffee and just watch people. It's an interesting exercise to do where you observe people and you just say, okay, that's the Pitta walking. Okay, that's the Vata walking. So extremely, and you have to make this a habit, whether you go in a shopping mall and sit there and watch people, or you go at airport is not that, you know, you can go and sit at an airport and watch people, but yeah, a shopping mall, you go there and watch people. There cannot be a better exercise to build up your observation capacity, to, you know, to sharpen your skills in terms of observation. And I still love doing that because that's invaluable. You know, the kind of people, the kind of things that you observe, the kind of things people do. And that builds up a habit for observing things which people don't usually observe. Meaning, I'm not talking of serious stuff, but I will tell you, you know, like I have a gym, okay? I have a gym, and if like now Diwali starts from tomorrow, okay? So obviously everything is closed here, okay? But we keep the gym open for 4 hours, 6 hours so that people can come and work out after having their sweets, etc. They can come and burn them out a bit here. So we keep the gym open and we have put up notices at least 6 locations in the gym, different places, starting from the main entrance to the floor entrance to the reception desk, everywhere. And since morning 5 o'clock today, I have been getting a call. Is the gym open today? Is the gym open today? Is the gym open today? And I always wonder that, do they have, like, you know, blinders in front of their eyes that they don't see these notices at all, or what is wrong? But it is not about that. I think people in general have very reduced awareness of their surroundings. In general, the awareness of our surrounding has reduced. And that is extremely important because once that awareness reduces, then your awareness towards your own bodies also reduces. And the only way you can build that up is by improving your observation capacity. The more you observe, the more you see, the more you read into it, you will start seeing things which are not seen by majority of the population. And I gave this example because I always feel that if I go to any place, I read every small thing and I know what is happening there, because your observation capacity has gone beyond the average population that exists in the world. Your awareness has gone beyond the normal population that exists in the world. And that can only happen when you train yourself to do that. Yes, Dory.
So how do we know it's a Prakruti and not a Vikruti when we observe? Is that mean that a Pitta will be sharp in his way of
Yeah, but what I'm trying to say here, Dorit, is irrespective of whether it's a Prakruti Vikruti, you being able to catch it just sitting there also is important, isn't it?
just
So
to catch quality.
just to, you know, like for example, oh, why is this person walking like this? Is there something wrong with his hip? Is there something wrong with his knee? Why is the gait like this? You know, so what kind of, why is this person you know, skin like this? What's wrong? So even if you keep on observing these things, that will give you a lot of insights. Then obviously when you sit down as a consultant to sit with people, that's when you define whether it's Prakruti Vikruti. But just to have an idea that, oh, I could differentiate that there is something different in this person is important. And to build that habit where you sit across a person without asking a question, to be able to identify that right from the time, you know, the person walks in, sits in front of you, gives you a tremendous edge. Because when you ask them questions, or when you ask them close-ended questions, which means something like, you know, do you have a particular problem, you know, which you have asking based on your observation. The first thing comes to that person's mind is, I have not written down in my case paper, I have this problem. How did this person know about this? I didn't say a word about this problem. How did the person know about this? You ask that question based on your observation. But that person thinks that, you know, you are super skilled. And that's important, because end of the day, we have to build trust, right, with our patients. Why, when we were small and when we were kids, we listened to our parents. They told us, don't go there, you will fall down. We followed that. Why? Because we trusted them. So in the same way, if your patient doesn't have trust on you, he or she is not going to follow what you suggest them. And building that trust, building that rapport where the person starts feeling comfortable sharing information with you, believing in you, opening up in front of you, is extremely critical. And that can only happen once the trust is built, once the rapport is built. And these are ways of building the trust by, you know, by asking them questions which you thought is what is happening with them. You know, I have asked questions to women, like, without their writing there, that do you have, you know, menstrual problems? Why? Because the person was sitting there, I could smell the metallic taste of blood. But that will only happen once you are, you know, the first time you observe that, and you would not know where the smell is coming from. But then when you start reading more, then you start understanding more, then you realize, okay, when you are asking questions and then you realize that, oh, she has a problem with menstruation, she has heavy bleeding, she has very strong pitta disturbances with her menstruation. Then you realize, oh, this is the metallic taste, metallic smell that they have explained in the Ayurvedic textbooks, which they call as Visragandha in the textbooks, which is metallic taste or foul smell or strong smell. So that you will observe when that you will relate to once you have done the questioning a couple of times. But after 10 times you have done that, 11th time a person sits in front of you and you smell that, you ask them a question directly, 99% of the times you're going to be correct. So it's basically developing the skill. It's like, you know, you're sharpening yourself every day with every new patient that you're seeing. So coming back to this, so Prakriti analysis, like we said, and like Pedro rightly pointed out, couple of questions related to psychology, and you should be done with constitution, because you don't get much time to really deal with this aspect whilst doing the analysis. Then when you're doing the Vikruti, you have to write down which dosha is aggravated, which dhatu is disturbed, which mala is disturbed. So you write about that. Okay, should we take a break 10 minutes and come back 12 o'clock?
Yes, right.
Okay.
10.
Yeah.